Today our topic of discussion would be adenoids. You have to remember that they are also known as the nasopharyngeal tonsils. Their precise location is the junction of the roof and posterior wall of the nasopharynx. In this particular picture, what you are seeing is a picture of adenoid after adenoidectomy. You can see that these are the ridges and the deep clefts, just like the lobes of the brain, right? This thing that you have to remember is that in case of the tonsils, there are crypts, but in case of adenoids, there are deep clefts, right? The lymphatics of the adenoid drain into the upper jugular nodes, and the nerve supply is important because the cranial nerve 9 and 10 are related with the adenoids, and in case of any sort of infection of the adenoids or any problem, there will be referred pain in the ear, right? The etiology is the rhinitis, sinusitis, and the chronic adenoid infection or any sort of allergy of the upper respiratory tract. The thing that you have to remember or understand is that sign and symptoms are not same for everyone. Some patients are having small nasopharynx, and in those patients, enlarged adenoid will produce a lot of signs and symptoms. On the other hand, an individual is having a large nasopharynx and there is adenoid enlargement, but still he will not be experiencing the same symptoms as a patient with small nasopharynx and enlarged adenoids, right? So you have to remember the symptoms. They are very important. The nasal symptoms are nasal obstruction because now the nasopharynx is obstructed. The patient will be a mouth breather. He won't be able to inhale or breathe nasally or will be having difficulty. The nasal discharge, the secretions of nasopharynx will be accumulated, as a result of which the child will be having a wet, bubbly nose, and sinusitis will occur. Epistaxis can occur because if there is obstruction behind, what happens is that when you blow the nose, there is increased pressure due to which epistaxis can occur. And voice change is that because the nasopharynx is obstructed, there will be a hyponasal voice, toneless voice, hyponasal voice, which is also known as rhinolalia clausa, right? Now, moving on to the oral symptoms, which are ear related, you can remember with the mnemonic of TACO. This is tubal obstruction. Eustachian tube is obstructed. Patient will be having retracted tympanic membrane on ear examination and conductive hearing loss. This is important. A for acute otitis media, C for chronic otitis media, and O for otitis media with effusion. The general symptoms that you see in a patient of adenoid inflammation or adenoids is that they're having a particular facial appearance which is known as the adenoid facies, in which there is nasal obstruction and mouth breathing, and the child will be snoring at night. This is the history which her mother will give or any sort of person which comes with that particular patient, right? And pulmonary hypertension and aproxexia is, which means that they're having a lack of concentration studies. Well, that is a symptom a lot experience even though they're not having adenoids. Diagnosis is made by, first of all, history will be giving you a lot of clues that you have to take on. Afterwards, you go for the examination. There are two things, either a nasopharyngoscope or in some compliant children, which is very difficult, you can see them with a mirror, right? So what investigations you have to do when you have to confirm the diagnosis of adenoid is that you have to take an X-ray of lateral view, right? And nasopharyngoscopy is important. Moving on to the treatment. So it all depends on the symptoms. If the symptoms are not that marked, you have to say the patient to do breathing exercises, give decongestants and antihistaminics. But when the symptoms are marked, it is excessively enlarged and it is obstructing in a way that it is going to affect and it is going to cause complications of the ear and other complication, then you have to do adenoidectomy, in which you just remove the adenoids, and this is removed endoscopically nowadays, right? And one important thing that you have to remember for adenoids is that they grow till 6 years, right? That is a normal case, but mostly and commonly infection occur, right? And then they further increase in size. It doesn't mean that after 6 years they're not going to enlarge. If infection is occurring, they will enlarge and they regress in the teens. And it doesn't mean that when a child is going into the teens, they will regress automatically. No. If there is no infection, then they will regress. If there is infection, definitely they will enlarge, even in the teens. So this is a concept that you have to remember, right? And this is it. The acute nasopharyngitis, these are the normal symptoms. You can just give it a read. Chronic nasopharyngitis, also give it a read. And thorn wall disease, as I have told earlier, that it is caused by the infection of the nasopharyngeal bursa. And the treatment is important. The antibiotics are given, and as well as marsupialization is done. This is actually a procedure in which the cyst is incised and its margin are stitched with the surrounding mucosa so that a depression is made and infection is not occurring, right? So this is it. Hope you understand.